Thank you. In this morning's Health Wash, for some student athletes, their back pain isn't going from too rough one day at practice. For our next guest, the excruciating pain was actually a sign of a bigger issue. So we're here in studio with spine surgeon Dr. Colin Haines. Thank you so much for being with us.
Good morning. Thank you for having me.
And joining us from college is Clemson University cheerleader Maggie Lang to talk about what is called Bertolotti Syndrome. Maggie, thank you so much for taking the time out this morning.
Thank you for having me.
All right, Dr. Haines, I want to start with you real quick. Just explain to us, what is Bertolotti Syndrome? It affects about 4 to 8% of the population. So not a huge percentage, but something really important that people, and parents specifically, you want them to know about.
Sure. Well, I got to start off, Maggie, I'm totally a Clemson fan now, so thank you very much. It's so cool to be able to cheer you on as you're cheering from the sideline. But, you know, it's really kind of sad because she had to travel so far to get her answers. Bertolotti syndrome is oftentimes diagnosed as a medical mystery where sometimes people have pain and they're told, you know, I just don't know why your back hurts. The reality is typically there's a cause. For Maggie, what it was is there's too much bone that actually formed between the bottom part of her lumbar spine, which is the low back, and the top part of the sacrum, kind of the bottom bone. So if there's too much bone, that bone can simply just rub on itself, cause a lot of pain. And for Maggie, the treatment was just removing that bone and giving her some room to breathe.
So this is something genetic?
Yeah, it's something someone's typically born with, and
okay.
it gradually gets worse and worse with time.
Okay, so Maggie, for you, how did it start? When did it start? And how bad did this pain get for you?
It started about middle of my junior year, and it went all the way through my senior year. It got pretty bad. I had to stop going to school my senior year because I wasn't able to sit in class for too long because sitting down would put too much pressure on it, and it would keep shooting down my leg. And then with cheer, it would just make it worse by getting inflamed.
So you knew something was wrong. You knew you had to go get it checked out, get something done. Dr. Haines, how do you diagnose this? Because as you said, it's a medical mystery for a lot of people. They just say, you're a young kid, you're having back pain. It's not as serious, you'll get over it kind of thing.
You know, I always say, if something doesn't feel right, something really may not be right.
Yeah.
And it just starts with listening to the person, talking to them, examining them, but really in-depth looking at their images and ultimately talking to them to figure out what are our goals and how do we get you back to life. So
for Maggie's treatment, you said you removed that piece of bone. Is that typical across the board for this Bertolotti syndrome?
Fortunately not. Most of the time we get people better with non-surgical treatments. We have a lot of times physical therapy or injections, sometimes regenerative medicine or even stem cells. But there are many circumstances like Maggie where we just got to remove that abnormal bone and get people back to their lives.
Maggie, how are you feeling now? You're a cheerleader at Clemson. It is rigorous on your body. Do you feel like you're back to where you were?
Yes, ma'am. I'm definitely like 100% better than I was before the surgery. Like, I can't even explain the different level of like even the enjoyment when I do my sport. Now I'm excited to go to practice and I'm not thinking about the pain that I'm going to feel while I'm there.
That is so important. What is your message to young athletes who maybe they're feeling this low back pain, it starts slow and then it starts getting progressively worse?
I would just say that I personally wasn't scared for surgery because I was just ready for it to happen. But I would say don't be nervous about being out from your sport for a little bit because in the long run, it's 100% better to go ahead and take time for yourself and do what you need to get right and then get back into it and be even better.
Maggie, I think you put it perfectly. A lot of people get really wary of any kind of surgery because they say, what if I can't get back to where I was? What if it gets worse? What if I don't recover? What do you say to parents, young athletes who might be dealing with something like this?
Yeah. Well, first off, just because you're seeing a surgeon doesn't mean you're going to end up with surgery. Most of the time, we can get you better with non-surgical treatments. But even if it comes to surgery, Maggie's an amazing example of this. We have the best, most effective, as well as least invasive treatments that really get people back to living their lives.
Maggie, what do you say to other athletes that are in your position and maybe other parents?
First, I'm sorry you're going through this. I understand it sucks. But I just think you have to have hope because I was starting to get really nervous as it kept getting worse because there was no progress happening. But you just have to keep looking and keep searching for a way to make it better, and it will get better.
Well, I'm so glad you're doing better and you're out there and you're cheering, and we're all cheering on Clemson with you now. Thank you so much for your time this morning. Good luck with everything. Dr. Haines, we appreciate you so much for being with us. Here's all your information at the Virginia Spine Institute. Thank you for sharing about, hopefully this opens parents' eyes and young athletes' eyes. if something is bothering you, if it is nagging at you, take action because there's probably a solution around the corner.
Dig deeper. Look for information on Instagram at Dr. Colin Haines, spinemd.com, even Google. There's a lot of good information out there for you.
But don't go down that WebMD rabbit hole.
Yeah, there's some good information, but you got to be smart about it.
Thank you, Dr. Haynes.
Thank you so
Appreciate
much.
you. Thank you, Maggie.